Why do we go mad? And how do we cure madness? Two questions the psychiatric profession has been trying to answer for centuries. More often than not, this quest featured the fatal combination of doctors who were too full of themselves and vulnerable patients who didn't really have a say in how their treatment unfolded. This led to terrible abuse, life-altering procedures, and the death of many. You might have heard of electroconvulsive and insulin shock therapies, and of the infamous lobotomies that turned their recipients into the human equivalent of a legume. But the story that follows is very little known, yet just as terrible as all the others. Henry Cotton was the medical director of the Trenton State Hospital at the beginning of the 20th century. He started his career quite promisingly. He was very well educated, had studied in Europe, and had been mentored by Adolf Meyer and Alzheimer themselves. Unlike many of his peers, he had a quite proactive approach to his profession. At the time, most asylums were just prisons for the patients. Their role was to keep them away from the outside world, and many terrible things were happening behind their walls. Psychiatry was in its infancy, and many wild theories were being thrown around. Cotton would have none of this nonsense. He thought that the medical staff should take a good hard look at the patient, not just write him off as crazy, and that patients should be treated with dignity. His approach to treating mental illness was quite different than that of his colleagues. He believed the cause for his patient's troubled mind to be physical, and thus very curable. His pet idea was called the focal infection theory. He didn't come up with it, but he was very enthusiastic about it. In Cotton's mind, abscesses or infections were the one and only possible cause for any type of mental affliction one could think of. Now, there was some reason to this madness. The French disease. That's syphilis, actually. Because the first recorded outbreak of the disease occurred in 1495 among French troops besieging Naples, it was given this fanciful romantic name. But there was nothing romantic about it. Left untreated, it wreaked havoc on one's body, and in its final stages, on one's mind. It is believed that at the beginning of the 20th century, between 10 and 15% of the population were infected with syphilis, and many of the asylum's patients were there for this very reason, their diagnosis being general paralysis of the insane. When in 1905 the bacterium responsible for the disease was discovered in patients' tissues, it provided the first physical answer to an abstract diagnosis. With this newly found hammer, Cotton proceeded to nail all his patients. First, him and his staff would employ quite a generous number of X-rays in search for the ever-eluding pocket of infection. And then, whether they found it or not, treatment began. It started quite conservatively, with pulling out any tooth that looked suspicious in the slightest. And boy, oh boy, did they all look suspicious. When the now toothless patient did not recover, it only meant that bacteria had been swallowed and infected other parts of his body. Despite the fact that he was never trained as a surgeon, Cotton would proceed to extract tonsils, thyroid glands, spleens, and to remove any other organs that he deemed not quite necessary. Experiments at the hospital, said Cotton, had demonstrated that the stomach is one of the least important organs in the body, and when it came to the large bowel, he thought that we can dispense with it just as freely as with the stomach. Female patients had their cervixes infected in about 80% of the cases. As for his male patients, Cotton thought that at least 50% of the chronic cases showed infection of the seminal vesicles, which needed to be enucleated. A typical example of Cotton's thorough treatment that many of his patients received was Mrs. Lullin. She was admitted to Trenton and diagnosed with depression and anxiety, for which she was promptly treated with a gastroenterostomy for her stomach ulcer, followed by the removal of the right side of her colon. When this failed to cheer her up, she then had the following unnecessary and very dangerous bits removed: her thyroid, her colon, her ovaries and fallopian tubes, and her cervix. Once there was nothing left to remove from the poor woman's body, a series of vaccine treatments followed, after which she was promptly discharged as recovered. Just like Mrs. Lullin, many of the Trenton patients were considered recovered, with Cotton boasting a staggering cure rate of 85%. Never before had the psychiatric profession seen such success. The newspapers loved Cotton, and he loved them back. The publicity brought him lots of private patients, and he even started lecturing at prestigious universities. Cotton was also very concerned with prevention. Why live in fear, waiting for madness to strike you, when just the removal of a few rotten teeth and a suspicious colon could give you a free ticket to a life of sanity? That's precisely what Cotton was preaching to both his willing and unwilling patients. This way, he prevented insanity in quite a few state correctional institutions, where he found that 75% of the juvenile delinquents had infected teeth and tonsils. Even more, he removed both his son's permanent teeth and part of the colon of his youngest boy. The truth is that Cotton was performing radical surgeries on people who didn't need them, in a time when antibiotics weren't invented yet. They weren't just useless, they were extremely risky. So how did he get such great results? Well, he didn't. You see, his patients' death rate was over 25%, and that was self-reported. In fact, in one paper published in 1922, Cotton stated that from a series of 250 colon operations, 25% recovered, 15% were improved, 30% were unimproved, and 30% have died. These were self-reported results, and you'd think that they were actually quite terrible and in no way supporting of Cotton's theories. But Cotton always blamed the negative outcomes on either their feeble condition if his patients died, or on the chronicity of the infection that had attacked the brain if they didn't recover. After undergoing such radical surgeries, his patients, if lucky enough to survive, were either very quiet or so scared that they pretended they were fine, and thus recovered enough for Cotton to use them to boost his statistics. There was plenty of controversy around Cotton's methods, and colleagues who tried to replicate his so-called treatments had very different results. This led to Cotton being investigated by his former mentor Adolf Meyer, who sent his assistant Dr. Phyllis Greenacre to find out what the real situation was at the Trenton State Hospital. Her report was damning. The statistics Cotton was reporting were poorly calculated by some of his former patients whom he was now employing. The death rate was actually closer to 40% instead of the reported 25%. No one in the hospital had any teeth, and patients were dragged into the operating room, kicking and screaming while being operated on against their or their family's wishes. However, Meyer was either too much of a softie, or he wanted to protect his former mentee and avoid a scandal, so he covered the whole thing up. A separate investigation carried out by politicians of the time also failed to uncover the gruesome truth, but it stressed Cotton enough that he went a bit mad himself, which he promptly tried to treat by removing some of his own teeth. In 1930, Cotton retired from his position as a medical director. He died in 1933 of a heart attack. This put an end to his terrible medical practices. Upon his death, he was hailed as this great pioneer whose humanitarian influence was and will continue to be of such monumental proportions. Monumental indeed, as throughout his career Cotton and his assistants had removed over 11,000 teeth and performed 645 major surgeries, of which many would end up killing their unfortunate recipients. His own sons would end up committing suicide later in their life. That was quite a story, wasn't it? So what do you think? Was Cotton mad himself? A narcissist? A fraud maybe? Some say that he went mad quite conveniently while being investigated by the Bright Committee, and then, even more conveniently, he promptly recovered after the removal of some of his own teeth. But then again, he did the same and even worse to his own children. He seemed to be well-meant, advocating for the humane treatment of patients, that he also operated on without consent, and a supporter of occupational therapy, but not until you underwent his procedures. Things are never black or white, which is great because now you have something to discuss in the comments. And if you'd like to know more about Henry Cotton, a book that goes into great detail on his life and career is Andrew Scull's Madhouse, a tragic tale of megalomania and modern medicine. Something to keep you busy until next time. Bye-bye now!